Well, hello everyone, and welcome to this virtual open archive event on healthcare in Princeton. My name is Hannah Schmiedel, and I'm the Public Humanities Coordinator at Princeton Public Library. This program is presented in partnership with the library, the Historical Society of Princeton, and it's made possible in part by the National Endowment for the Humanities. So we're here this evening to learn about some of the history of healthcare in Princeton with the Historical Society of Princeton's Curator of Collections and Research, Stephanie Schwartz. These open archive programs are an opportunity to see some of the Historical Society's collections up close, learn about the items, and become the historian yourself by looking at objects and asking questions. The format of the open archive this evening is obviously a bit different than our in-person programs if you've ever been to one. So let me tell you a little bit about Crowdcast in case this is your first time. If you'd like to toggle into full screen so that you can see the presentation more clearly, you'll see in the upper right-hand part of your screen a little box so that when you roll over it, it says toggle full screen. So that's up to you if you'd like to be able to see the presentation a little more fully. The chat feature I will disable shortly. That's on the right side of your screen. That'll be disabled for most of the program. And if you'd like to ask a question for Stephanie, please use the Ask a Question feature that appears on the bottom of your screen. At any point during the presentation, you can submit a question there, and other audience members can see those and upvote them. After the presentation is complete, I'll read some of those questions for her to address as well. And at the end of the program, I will switch the chat feature back on. This is because we value the input of the attendees in the discussion. If we were at an in-person open archive, one of the best parts of the format is that attendees can move around the space and talk to one another about what they're seeing, what they're learning, and discuss with each other and with Stephanie. So we'll kind of use the chat feature to try to accomplish that more discussion type of program at the end. So our presenter this evening is Stephanie Schwartz. She's the Curator of Collections and Research at the Historical Society of Princeton. She joined the staff there in June 2012, previously serving as Research Assistant and Admissions Associate. As the curator, she oversees all the collections operations at the Historical Society and manages their research services. She earned her BA in History and a certificate in Museum Studies at Connecticut College, and she received her MS in Archives Management from Simmons College. She's also worked at HBO, the Schomburg Center for Research in Black Culture, the New Jersey State Archives, and the Mercer County Library System. So let me bring Stephanie up on stage here, and we will proceed with the program.
Okay, thank you, Hannah, for that introduction, and welcome everyone to our first virtual open archive. While we miss seeing all of you in person, we're so excited to have you join us tonight for this digital reinterpretation of what is personally my favorite HSP program, so I'm excited about it. For the next 30 minutes or so, we're going to explore archival material related to Princeton healthcare during the first few decades of the 20th century. This was a period that proved to be quite formative with regards to public health in Princeton. It includes the creation of a district nursing program, the establishment of Princeton Hospital, and yes, the 1918 flu pandemic that resembles so closely what we are going through today. Now, this program is not intended to be a comprehensive look at these topics, nor a complete overview of Princeton's healthcare history. That would be a lot of information to cover, and our archives, frankly, don't have all the documents that would be needed to do that. Rather, we're going to deep dive into a handful of items from the HSP archives that will help tell this story in a small way. So, first up, we have this notebook from Juliana Conover, who was chairman of Princeton's Neighborhood Nurse Committee from 1902 through at least 1915. I'm not quite certain about her end date, but you can see how it's from 1902 there. Now, the Neighborhood Nurse Committee was one of Princeton's first forays into public health, and it was a direct predecessor of Princeton Hospital. It was first suggested at a meeting of Princeton's Village Improvement Society in October 1900, and then it was later organized in February 1901. Miss Elizabeth Leavitt Howe served as the first chairman. We have here a list of some of the first women involved in the Neighborhood Nurse Committee. For some reason, Mrs. Howe is not listed here among the women, but there are a lot of other prominent Princeton names and addresses of the period that are represented. And that includes Cleveland, who lived over at Westland, Stockton, resided at Morven. You had the Russells at Edgerstone, and the Morgans of Constitution Hill are all depicted there. Now, this notebook also includes a list of the regulations set for the neighborhood nurse, accompanied by dates, which I'm kind of assuming might have been the dates that these regulations were put into place, but I'm not 100% certain on that. Some of these regulations included that the nurse could not intend contagious diseases. The nurse shall be subject only to the call on approval of physician in charge of care, except in cases of emergencies. And the nurse may be permitted to hire a carriage in extreme weather or when she had visits far apart to walk. And the committee eventually later on provided the nurse with a car to use. However, the nurse was only able to do visits within borough limits. The township was another matter. Some other regulations included the nurse's office hours. She was on duty from 7:30 to 8:30 a.m., 12:30 a.m. to 1:30 p.m. That would be 12:30 p.m., I think, but it might have been written wrong on there. And 7 to 8 p.m. And then the nurse was also expected to wear her uniform when on duty. The nurse did get Sundays off as well. She worked 6 days out of the week. So the committee funded the rent of the nurse's room as they felt that it was important for her to be in a central neighborhood and have a storeroom or a large closet to store supplies. The first nurse, Marjorie Cox, lived at 4 Witherspoon Street. And then a year later, they obtained larger quarters for the nurse in a cottage on Bayard Lane. By 1916, the demands for the services of the current nurse, Miss Ida Anderson, were so high that there was no room at the cottage for her anymore. And they installed the nurse at 25 Bayard Lane, which is pictured here. And the nurse lived here until eventually she had a room at the nurse's house at the hospital. Now, the house served as a medicine dispensary, an emergency room, and an infirmary for the nurse. Now, glued into this scrapbook from the Neighborhood Nurse Committee are also published reports dating from the committee's first year in 1901 to 1915. The one pictured here covers 1901 through 1902. And just give a better look here at the inside. It includes information about the number of calls, the rules and regulations that we discussed for the nurse, and the treasurer's report for the year. And we can see by looking at it that from February 15th, 1901 to February 15th, 1902, Princeton's first neighborhood nurse made 632 calls. The yearbook for the Village Improvement Society from that year called this a good record when we realized she has to gain the confidence and support of the physicians in this new enterprise. So now we're going to look at the report from 1918 to 1919. You can see here by 1918, Juliana Conover was no longer the chairman of the Visiting Nurse Committee. She'd been replaced by Sarah Green Duffield, though she still served on the advisory board. You can see her there. The committee is now referred to as the Visiting Nurse Committee, and the following year, the name would change again to the Visiting Nurse and Hospital Committee. Great. And here's a look at the inside again. We have the regulations and the annual report of the visiting nurse. And you can see here that from October 1918 through October 1919, the Visiting Nurse Committee made a total of 1,983 calls, which is a huge increase from the 600 in their first year. So now in this 1918 through 1919 report, there's surprisingly no mention of the flu epidemic that took place over the past year. Because if we remember from our earlier list of regulations, the nurse, what's highlighted here, the nurse goes by the hour to all persons needing her in whatever circumstances except to contagious diseases, of which naturally the flu was one. So the Visiting Nurse Committee wasn't really involved all too much in the flu epidemic. However, if we look at the chairman's report that is included, you do find mention of Princeton Hospital being developed. They call it here an accomplished fact and mention that the town council took up the matter in the autumn and in connection with our committee has the building almost ready for occupancy. Mr. M.T. Pine, Moses Taylor Pine, kindly gave the property 253 Witherspoon Street, which has lent itself splendidly to the alterations and when completed will accommodate about 20 patients and will be a cottage hospital of which the town should be justly proud. So at this point, the wheels were turning to get Princeton a hospital. So now we need to take a look at the 1918 flu pandemic and its effect on Princeton, because it's no accident that Princeton's first permanent hospital followed 2 months later. Moses Taylor Pine donated the house in December 1918. So here are some numbers. Globally, there were 500 million cases of the flu, which is around 25 to 33% of the global population. This resulted in 50 to 100 million deaths. Then in the United States, 28% of the population was infected. Now for New Jersey, statewide, there were over 211,000 cases of the flu, which was 7% of the state population, and that led to over 18,000 deaths. And then finally, Princeton, we had 300 cases of the flu, which was 4% of the local population. About 50% of these cases developed into pneumonia, and then 20 of those infected died. Now, one fun fact about the flu pandemic in Princeton is that none of these deaths were university students. The university experienced 0 student deaths during the pandemic, which was a fact that was studied by the University of Michigan Center for the History of Medicine. So it was a bit of an anomaly. So while HSP, unfortunately, does not have a lot of primary materials documenting the flu pandemic in Princeton, newspaper articles from the time do exist that tell us the story. And these articles all came from the aforementioned University of Michigan, but we have copies of the Princeton packet in our collection as well. The first death from the flu in Princeton was reported in the Princeton packet on October 4th, 1819. It was Kate Welch, a resident of Greenview Avenue. And you can see here in that same issue, a quarantine was announced. The Princeton Board of Health proceeded to close all schools, churches, movie theaters, pool rooms, and other places where the public gathered immediately and until further notice. And that is highlighted here for you. And this was done not because there was an unusual amount of sickness in Princeton, but more as a precaution. So then cases in Princeton began to wane by late October, and the general quarantine was then lifted on Sunday, November 3rd. One fun fact is that all the churches closed except for St. Paul's, which is explained here in this article as well. The article also goes on to mention that it must be noted, however, that in some places, as New York, the epidemic still continues, and the people of Princeton are urged to see that anyone suffering from influenza is kept out of contact with others. Such sufferers, even from what appears to be a bad cold, should remain at home and in a room apart from other members of the family. Sounds kind of familiar. And then I love this here as well, that the board wishes to thank the people for their tolerance and patience with the hardships necessary to the quarantine, which in some cases involved financial loss, and to express regret that in some instances the recommendations were not heeded. The board had legal power to enforce the general quarantine in epidemics such as the present, with the exception of the public schools and the churches. The board consulted its lawyer with regard to the legal right to close St. Paul's Roman Catholic Church, which held open services last Sunday, although requested and notified not to do so, and found that there was no law at this time which would support them in this action. So all of this led to the creation of an emergency town hospital for Princeton. Cases in Princeton that required hospitalization were first sent to Trenton, and after a few days, the Trenton hospitals had no space to receive cases from Princeton because they had too many cases of their own. So this October 11th, 1918 article from the Princeton Packet announced the immediate creation of a town hospital that they threw together super quickly to serve those sick in town. It says here that the many cases of influenza and pneumonia in town have made this institution an absolute necessity, for in this way, as in no other, could the poorer families be cared for. And the article also goes to call it a dream of a town hospital that has at last come true. So they established this this emergency hospital. It was established by Princeton Health Officer T.W. Marjoram at the Green Home on Stockton Street, which is near where Trinity Church is today. It was fitted out with 20 beds, and during the course of the pandemic, over 100 people were hospitalized here, and out of those, only 6 died. So the course of this brought to light that Princeton kind of did need a permanent hospital, and this newspaper from the Princeton Packet in November 8th, 1918 points that out as well. So we have here pictured what was known as the Pearson farmhouse. And this was the farmhouse given by Moses Taylor Pine in December 1918 to the town for use as a hospital. At the time, J. Golden Pearson had been operating a dairy farm on the premises, which is why it's known as either the Murphy Farm or the Pearson Farm. And then on November 24th, 1919, it opened as the first Princeton hospital with a staff of 5 doctors. So we have here, as another document, this January 1919 prospectus from the Princeton Hospital Association and their Committee on Endowment. So we can take a closer look at this. You can see here in the appeal on the right that it reinforces the need for a town hospital, saying a town hospital for Princeton has long been needed. Deaths resulting from the lack of a local hospital and the recent life-saving work of the emergency hospital on Stockton Street have proved its necessity. The realization of this desire is now made possible through the generous gift of Mr. M. Taylor Pine to Princeton of the Murphy Farm on Lower Witherspoon Street. with the house on it built by Dr. Carnahan, the former president of Princeton College. And now if we look on the inside of this prospectus, it's some things that we to highlight are that they originally, this building was seen only as a temporary solution, even in 1919. It says here, it is planned to use the present building temporarily. Needed alterations and equipment, including an emergency operating room, will be paid for out of the hospital fund. And then down here, that this fund will first be used to set up an endowment. And then later it was going to be for the erection of a modern hospital building, and encourage the town, saying, Princeton has recently shown a wonderful spirit of generosity in causes connected with the war. Here is a cause which can benefit the town itself. We believe that every citizen will wish to be represented on the list of subscribers. So already in 1919, we're finally established Princeton Hospital, but we're still thinking of what the next steps would be. So here we have a portfolio. This was the fundraising portfolio from Mary Kingdon Day during Princeton Hospital's campaign for $600,000, which sure enough, they didn't fundraise the money in 1919, but by 1925, Princeton Hospital needed to expand. They needed more room for everyone who was coming in. And so in 1926, they established the campaign for $600,000 to raise money to build a new hospital. And Mary King Day was one of the fundraisers for that and used this portfolio. If we flip it over, you'll see here it provided lots of information and tips for fundraising for the hospital, including what to tell your prospect, and it tells about the need for a new hospital. A new hospital of 56 beds is required to meet the health needs of this district. The present hospital has a capacity of only 22 patients. Its wooden building was not fireproof. All the fundraising paperwork about this campaign mentioned that the building was not fireproof. That seemed to be a major concern of theirs. Besides, it lacked many modern facilities necessary for the best care of patients. And down here, it talks a little bit more about the present hospital. In the last 5 years, with only 22 beds, the Princeton Hospital has cared for 3,105 patients. 426 babies have been born there since January 1st, 1921. The number benefited by its dispensary has grown from 18 in 1922 to 322 last year. The new hospital will have wards, semi-private and private rooms, and bassinets for babies. A modern operating department, complete maternity department, x-ray department, laboratory, dispensary, children's department, accident room, receiving wards, and isolation rooms would complete its facilities. So all the goals that they had in this fundraising pitch. It also mentions why people should help and arguments to use for that. My favorite here was that this new hospital would be open to all, regardless of race, religion, or ability to pay. It will be devoted solely to the services of the people of our hospital district. And then this right panel talked about how to obtain subscriptions and reminded people to tell the story, saying that after learning the facts of the appeal, you are more enthusiastic, and also saying to make personal calls, saying telephone and written appeals get silence, excuses, or regrets. So if we flip back to the inside of this portfolio, you can see here the campaign progress as it was recorded. About 5,000 residents of Princeton subscribed $602,000 to the new hospital. And then as a result, on January 3rd, 1928, the Princeton Hospital on Witherspoon Street began its service to the public. And we have here a picture of it in the 1970s. And this was the hospital that was on Witherspoon Street. It was expanded once, but was there until the 1990s. So just some other documents that I wanted to highlight tonight. Now we have 3 of these, so there's a lot. There are items in our collections that could prove to be a treasure trove of information about Princeton Health. They're the records of L.V. Sylvester, the Princeton Township Health Officer from 1923 through 1950. You can see that this is only one of 3 volumes that we have, and it covers 1923 through 1926. And these just kind of show that public health in Princeton continue to be a topic of concern and issue and advancement in town post the flu pandemic, post the development of the hospital, and that something that continue to be a factor. Some of the entries that are included on this page here include this one: place scarlet fever sign on Collins House on Alexander Street. There are a lot of mentions about scarlet fever on here. And this one about telling someone to empty a cesspool. So, as you can see, our ability to connect the past to the present in these very relevant ways depends on what has been preserved of previous events. Historians rely on documents, newspapers, images, and personal recollections to weave together a narrative about the past. And we hope you will help us make sure that there is a robust record of the COVID-19 pandemic and its impact on Princeton for future generations to observe and understand. And there are many ways you can help us collect information about COVID-19, and some of those are listed here. You can share with us photos, documents, and other materials that illustrate the pandemic's impact. You can complete a Google form with your written observations about the pandemic's impact. You can journal over a longer period of time, or you can record a Voices of Princeton oral history interview to document your experience. On the Voices of Princeton website, you can find details about how to record a COVID-19 oral history interview, either by yourself, with someone in your home, or with someone virtually. The guide includes sample questions, technology suggestions, and submission instructions, and we hope you participate. The link at the bottom of the screen will take you to the Historical Society's History at Home page, which contains further details about how you can participate in building the historical record. All right, and that is it for my lecture. I think we're ready for questions.
All right. Well, thank you so much. That was really interesting to walk through that history, and especially to tie it back to today's collecting initiatives that's going on at the Historical Society. We've got a question in the queue here about the credentials of the first nurses that you were talking about. So how are they? What were their credentials? And I'm also struck that you talked a lot about all those nurses were women. I have to assume perhaps that most of the doctors were men, and it's just an interesting dynamic in that there's seems to be some more documentary records from the nurse perspective than the others, at least in this.
Yeah, we do have some doctors' records in our collection, but they all tend to be much later, or in a sense. And I think with the nurses, I don't remember directly where I saw this, but I believe they would find them through hospitals and reach out to hospitals and for recommendations. I remember seeing somewhere that one left that they loved, and they went to the same hospital looking for someone similar to replace her. We also noticed that a lot of the nurses were unmarried, so we assumed that maybe once they did get married, they couldn't continue working as a nurse in that sense. So a lot of the nurses did seem to have experience as nurses before, and came to Princeton from a hospital, from what I could see.
Another question from a participant was about the fact that you cited that no Princeton University students got the flu. Was there a particular, was there ever sort of a reason identified for that? Were there professors or staff that got it?
The study, there's the study that the University of Michigan did gets into this in much more detail. And I think there was a recent Town Topics article that discussed it as well. But there was, I believe, a part of it was there was a military presence on campus at the time too, so they were able to have very strict rules, like the students were not allowed off campus or to go to any downtown establishments during that. And they did a really good job of making certain that healthy people didn't come in contact with sick people. But there's certainly there's a lot more information about that out there, more than I could speak to at the moment.
And a question on the materials in general, were they all donated by individuals over time? I'm curious how these items enter the Historical Society's collections in a general sense.
A lot of these were donated to us by individuals. I don't know if we have, a lot of times those records have gotten lost over the years of who the exact donors were. So I'm trying to remember. I would love to know who donated us the Neighborhood Nurse Committee book, but I'm not certain about that one off the top of my head right now. But yeah, we normally love for people to reach out to us with anything they think might be interesting. And we're more than happy to consider that as something to include in the collection.
And sort of two related questions from audience. How long did the quarantine in 1918 last? And also, are there records or photos of people wearing masks during that pandemic in Princeton?
We have no photos that I know of people in masks in Princeton. I know there are lots of photos floating around of other cities, and a lot of times they're used on posters telling people about the 1918 pandemic as well, but I haven't seen any myself of Princeton. I would love, if one exists, do let me know, because that would be great. In Princeton, the quarantine lasted from beginning of October to beginning of November. It was about 1 month. They opened, I think it was Sunday, November 4th or November 5th is they reopened, so that way people could go to church, and then that the schools could open on Monday and the movie theaters could open on Monday. were the priorities.
There's also a comment from a participant that it's remarkable that Princeton Hospital was meant to treat people regardless of race at a time when much of the town was segregated. Is that something that has come up in the documents that you've looked at, or was that? That's
not something I saw anything about, and I frankly, I kind of now want to go back and take a closer look at them again, because that's a really interesting point and very true. To see whether you could find any documentation that it did treat everyone regardless of race. That's something it would be nice. It would be fun to look at the records again and see and look into that further.
And if anybody else has any questions that they'd like to ask in the question box down here, or observations they'd like to put in the chat. Is Princeton Hospital now sort of invested in documenting their own history? Are they interested in understanding how they came about, like as an organization? Is that something they've pursued? It seems like it's about their 100th.
Yeah, they celebrated their 100th centennial in November, and we actually presented a version of this open archive at their centennial event, talking about the early history of healthcare in Princeton. It was a great opportunity to pull some of these documents out and get them to a healthcare audience, which was fun. And they had a lot of photos and recollections of their history that I hadn't seen before there, which was nice.
All right. Well, I think we've pretty much addressed the Q&A from the audience, but I'll thank you again.
I will say also, if anyone else ever, we are still operating our research services at HSP, so feel free to send me or Paul Davis, our research assistant, an email if any other questions come up. That's at research@princetonhistory.org, and we'd be more than happy to look into anything after the fact.
All right. Well, thank you very much. I'll remind people there's the History at Home link at the bottom of your screen, that green button. If you'd like to contribute your stories about what's going on right now in your day-to-day life. And thank you again to the Historical Society for putting this together, and Stephanie for presenting this evening, and for all of you for attending. We really appreciate it, and we hope to see you soon.
Thanks, Hannah.